Good afternoon and welcome to this edition of Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, and streaming on Facebook Live. We're taking your questions. Let's start there. You can go to our Facebook page or you can go on Twitter at WCTV Info. Send us your questions. We've got two people here that are going to answer them. I am not one of those people. We do have Dr. David Jetmore, Wayne County Health Officer, back from wherever it was he was gone to last week when Christine Stinson sat in for him. How are you, sir?
I'm fine. I'm glad that you let me off for that week so that I could replenish myself and hopefully be even better. But it's tough to follow Christine. She's such a knowledgeable and good spokesman for our department.
Mm-hmm. And we've got Dr. Thomas Huth, Vice President of Medical Affairs at Reed Health. Sir, as always.
Thank you for having me.
It has been another week. Let's start with what's new, what do you know?
Well, of course, the world's all talking today about President Trump's positive test and the First Lady and I think one of their senior advisors as well. And I'm gather the thinking is that it was the advisor who brought it in, but I don't know. Wish him well, but apparently has few or no symptoms, and we hope it stays that way.
What I saw was mild symptoms, is the way it was described, and I'm not sure what that would mean. As a medical professional, if you hear someone has mild COVID symptoms, what are you anticipating when you hear that?
That's a good question. I think.
Damn, I used my best one in first minute.
Don't use them all up this early in the show.
Usually when somebody starts off an answer with, that's a good question, that means that there's not a great answer to it. But, because the symptoms can be variable, but I think the most common ones that I hear are headache, cough, and fatigue. Probably cough maybe early on as being a little bit more frequent. Mm-hmm. But we haven't heard specifically what the president is experiencing, and maybe we will with time.
When you hear mild symptoms, same thing, or do you think of something else?
Well, to me, it's tiredness and maybe a slight fever, but it would be symptoms that don't really debilitate the person or put them in bed. That's what I define as mild symptoms. He probably at a minimum feels tired, and since they said he did have some symptoms. But yeah, I agree with Dr. Huth. When you start getting some of the other symptoms, shortness of breath, which is always an alarming symptom, mm-hmm. And then GI, gastrointestinal symptoms, those are more debilitating to the patient.
Mild symptoms. One of the things that you both have talked about over the last number of weeks is that loss of taste and smell. Does that fall in the mild category, or is that something a bit more elevated when that kicks in?
Well, I guess so. If to go by Dr. Jetmore's definition of what's debilitating enough to sort of put you down, disturbance of the taste and smell might not be, or probably wouldn't be, but we like that symptom in terms of being a little bit more specific for COVID-19, but not everybody has that. Yeah. And I don't know in this case whether that's a factor here.
Sir, it's been another week, well, two since we've seen you. What do you know new this week?
Well, we've had from Sunday through yesterday, we've had 57 positive cases here in Wayne County, which is up from last week. I think we had, I'm thinking 24, but it was 20-something cases last week. One of the things that we live in fear of in the health department is an outbreak in a nursing home, and we had an outbreak in a nursing home. We had 17 cases today reported from one of our nursing homes, which brings the total at that nursing home to 30. Is exactly the part of our population that we do not want to get infected. They're the most susceptible to serious symptoms and even death. Obviously, the people in the nursing home didn't bring this in. They're confined there in the nursing home, so it's the people that work in the nursing home have brought the virus into the nursing home. So And Dr. Youth, who works in nursing homes all the time, has emphasized how important it is for the workers to really be strict about their behavior when they're outside the workplace, because they're the vectors here. Mm-hmm. And I think it's easy for them to let their guard down in social occasions or with friends, and that's probably what happened. We don't trace, local health department does not do the case tracing for the nursing homes. The state does that, so I don't know the exact vectors that came into play there. I'm just speculating. Mm-hmm. And speaking of nursing homes, we had a meeting this week with several, Dr. Huth was included in that meeting with several heads of nursing homes about indoor visitation. We haven't allowed indoor visitation all summer long, and it's worked out well, but we put some rules in place to bring in indoor visitation. Obviously, the weather's getting colder. People want and need visitors. You tend to become isolated just as a fact of growing older. And so we want these people to have visitation. We want to keep them safe. We have a flu clinic tomorrow. At the health department will be doing this at the Elder Bierman Clinic. This is from 10 a.m. to 2 p.m. And bring down what insurance information you can, but everybody will get a flu shot, insurance or not. So I see you have some signage for that, Eric, so we'll be prepared for that.
We will be. I was trying to get the crew to find that real quick and see if they could bring that up while you were talking about it.
And before I conclude, I think it's important to tell everybody that we're at stage 5 here in Indiana, but that doesn't mean it's over. We still need to wear masks, socially distance, and practice good hand hygiene until we get to the point where we can get ready vaccinations. So hang in there, people. There is a light at the end of the tunnel. I'm hopeful that we'll have a vaccine by January. Some people think even sooner than January, and hopefully that will be true. But so we've got a goal to work toward. I mean, think about where we were back in March. So we need to kind of hunker down and make it through these next 2 to 3 months.
Okay. I haven't asked you this for a while and just want to check in with the folks at Reed. This has been and you talked about March, this has been a constant, ongoing, we've seen the numbers week in, week out, up, down, almost constantly someone on a ventilator. Has the team there been able to get used to this, take a breath, get a rotation, pull back a little bit, schedule vacations and time off and things of that nature? Because I know that for a while, for some people, was really kind of a difficult thing.
Yeah, for a long time we restricted travel and vacation time, but you're right. We've kind of gotten into a rhythm. We all feel like we know what we're doing now. The numbers have not been overwhelming, and so pretty much life at Reed has been as normal as you can be, but still have COVID in the background. And I think that's a good metaphor for the rest of society. I'm trying to teach others to not think of vaccines as going to kill the virus and everything will go back to the way it was in February of 2020. For a lot of reasons, we're going to be dealing with COVID-19 for a good while, I think. And we can get into the reasons for that, but it's a long discussion, really. But it means that we have to figure out how to have life and work while we have COVID, but to do it safe, smart, and be vigilant. And Dr. Jetmore referred to the vector of infection into nursing facilities, and it's really kind of the same theme that I think a lot of businesses have, and certainly we see it at Reed. We've had a number of outbreaks amongst staff where clearly it was another staff member who got exposed in the community and brought it in and exposed people at work. So what that means is regardless of the environment, we have to be smart and avoid exposure to begin with, but when we're at work and not in direct client or patient-facing activities, we still have to be vigilant and use protections when we're simply with our coworkers. That's a place where the natural tendency is to kind of let the hair down and take off the masks and huddle close together, but it's very important to be vigilant in that environment so that if somebody does come in exposed, they reduce their risk of exposing other coworkers. And then, God forbid that makes its way to a patient or a client, depending on the business that you're in. So the same theme, I think, applies across all industries, and I've just written an article for the monthly magazine of the Indiana Chamber of Commerce, kind of teaching to that theme. And so I think what we've shown in healthcare is that we can adjust and adapt and do the right things and have normal operations and have relatively normal lives if we'll do certain things always and everywhere.
Is there a frustration still that it's hard to get people to continue to do that or do that on a regular basis? I mean, they think that's one of the reasons that COVID was able to get into the White House. It's an area where people, Chris Christie, former governor of New Jersey, was talking about the president's debate prep. Said there were 5 or 6 people in the room. None of them were wearing masks at the time. So, you always have to be careful as to who is around you and where they are, particularly when you're near people who are vulnerable, which is what you all are talking about.
If you have bad behavior on the part, Eric, of somebody that has has the disease, there's a large study published from India that showed that 80% of the positive cases were caused by 5% of the people. So, if you've got somebody that's infected and they're not wearing masks or socially distancing, it's amazing how many people those people can infect, in a cascade of going outward from them, infecting 3 to 4 people, or those people infecting 3 to 4 people, and so on. So I think that's an example of, when you're talking about that debate prep, of people letting their guard down. Those people probably felt safe. Their president's getting tested every day, but getting tested doesn't prevent disease. It just tells you have disease when you get it. It's unfortunate, but maybe some good will come out of it. Maybe people will be more vigilant.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live. Thanks also to the folks at CTV3. Don't air this live, but they do air replays of this, so thank you to John and his staff down there. We always bring somebody in on Zoom, and this one isn't really a guest. It's almost like a member of the family. Christine Stinson, Executive Director of the Wayne County Health Department. How are you today?
I'm doing very well.
Good.
How are you doing?
You've got a nice smile on your face. I guess that means you're prepared for everything that's coming your way right now. You're relaxed, you're calm.
I'm here.
Okay. Tell us a little bit about the flu clinic tomorrow.
Yeah, we are getting all geared up for that. That is at the old Elder Bierman site. We'll have you come in to the site. We'll have several stations. There'll be no COVID testing at the time. The space is thoroughly cleaned and sanitized, and we'll be ready for flu shots. We will have some curbside services available for elderly, handicap, or someone that just doesn't feel comfortable to come inside. We will have a couple of teams out there doing curbside services. It may take longer to have curbside service than the walk-in, but those services will be available. And then we are starting to schedule our community clinics, which we're bringing a flu clinic to every school district. It's not just for the students or for the staff. It's a community clinic, but it will be in every school district. Haven't really announced a lot of those because I wanted to focus on the event this Saturday from 10 to 2 at the Elder Bierman building.
Okay. Dr. Jetmore mentioned that there has been an increase in the numbers this week. You want to talk about that a little bit, and also talk a little bit about how things are going now that you've kind of got a week under your belt with you all running the site at the former Elder Bierman building and OptumServe in Cambridge City.
Yeah, it was a little bumpy start. Somehow there was some confusion that we closed the site at the Elder Bierman and moved everything to Cambridge City. And so there was anger, of course, that why would you shut down in Richmond? And I'm like, I didn't shut down in Richmond. I added a site in Cambridge City. Yay, more availability of testing. So there was a little bit of confusion out there. Some radios and reporters were reporting that we closed down the site and moved it to Elder Bierman instead of saying, we've moved one of the testing teams to Cambridge City. So that's more of what it is. We still have testing at the Elder Bierman building from 8 a.m. to 6 p.m. Monday through Friday, but we've added testing in Cambridge City from 8 a.m. to 8 p.m. Monday through Friday. Testing is going well in both places. We're getting people to go out there to Cambridge City to be tested, and we're still testing here in Richmond. So last week we did see a little bit of a dip in our testing numbers overall, but this week we're kind of coming back up at our overall testing numbers. That may have played a role in why we saw a dip in our cases last week too, because we had a dip in the total number of people that were being tested last week.
What kind of numbers are being tested, Christine, in each site?
I had like 10 minutes to prepare for today. I don't.
Let me rephrase the question. What would you guess, Christine, are the numbers of people being tested in each site?
I would guess we're testing about between 40 and 50 people at the Cambridge City site a day. And here in Richmond, I know that we had tested 80 before noon today. So today was a really big day for testing. I think we're averaging about 80 a day at the Richmond site, at 20 to 30. So we're still a little low on our numbers, but we're coming back up. Anytime you make some changes with things, there's a disruption in the force. And we're feeling a little bit of disruption and hoping to get our numbers back up to even above the numbers when we started.
Do we have to hit certain numbers of that Optum site in order for that site to stay there?
Right. So the OptumServe site that has been moved to Cambridge City, that is a site that is with a contract with OptumServe through the state health department. And that's a month-to-month contract between LHI and the State Department of Health. They have renewed the contract through the end of October, but past October, they're not sure that they'll renew any of the sites of the state of Indiana, not just Richmond, but they have assured us any of the sites that are consistently testing over 100 people a day or around 100 people a day, they will keep those sites. They don't want to lose valuable assets to each community. But if the site is being underutilized by the community, they'll probably not continue that. So I do encourage people in that Western Wayne area to utilize the Cambridge City site to be tested, especially if you have symptoms, especially if you're out and about in the community where you're exposing yourself. Just to regularly go out and be tested so you know your status. We know a lot of people are asymptomatic, and a lot of people just show mild symptoms. I will tell you that I heard that the president explained that he was having allergy-like symptoms, very common allergy-like symptoms. So that's what or they're considering the mild symptoms. And after he had those allergy symptoms, he went to the doctor and was tested, or reported to his doctor and was tested. So I do hear a report of a runny nose is kind of one of the first things that most people will talk about, is a runny nose and maybe a sore throat, then the cough. nausea, diarrhea, and then the headache and the fever start.
Christine, thanks for being here today. And you were on that call earlier in the week that Dr. Jetmore referred to at the top of the show when we talked to several nursing home administrators to get some feedback on what would work from an indoor visitation standpoint. And of course, you've provided them some standards and so forth. Tell us about what some of those standards are for indoor visitations.
Okay. We think that it's important that we limit the number of people that are visiting. So each resident will only be able to have 2 visitors a day. Those visitors have to pass a screening tool that will be implemented by the long-term care facility. It will be in designated areas for visitation that will be cleaned and sanitized often after each visit. No eating or drinking during those visits because we know that not wearing a mask increases your risk. So if you have a loved one in a facility and they love to get a milkshake from Culver's and that's kind of your thing to do, you can still provide the milkshake. It will just be, they can enjoy that milkshake or the hamburger after your visit, not during, because we don't want to put those people at risk of contracting the COVID-19. Some of the other things, the screening tool, masks have to be worn, and the social distancing are all of the things. I'm not really sure what else that the people would find interesting about those. Do you have a particular one that you had in mind?
Well, I was going to segue over to a discussion of the positivity rates because I know that your standards are kind of, they refer to the state standards, so we have to, the facilities have to fit with the state standards as well as what you've implemented locally. And I think one of the state standards has to do with they can do certain things or even have the indoor visitation as long as the positivity rate and other indicators of community spread are below a certain level. Now,
Sure.
Where I'm segueing over to is we just said that in the last few days we've seen a really significant increase in the number of positive cases amongst Wayne County residents. And you also said, I think I heard, that because of confusion about the testing sites, what was open, what wasn't, the number of tests may have dipped down. So there is a mathematical equation that goes in there. The number of tests compared to the number of positives is going to determine your positivity rate. And so I'm wondering, is that something you're going to watch closely because it may have some impact on what we do going forward?
Correct. Yeah. So the positivity rate of 10 is kind of that key indicator of when things will really stop happening in nursing homes. So for nursing homes, we need to keep that number below 10. Right now, we're at I believe it's a 4.6, somewhere between a 4 and a 4.6. And we think, well, that's great. Last week we were at a 2. So things can turn on the dime and go really bad. That positivity rate, that factor, has different implications on different parts of our society. So our long-term care facilities, we're looking at that, but our schools also, we look at that positivity rate. And when we get around a 5% positivity rate, there is implications for the schools, and where we'll look to schools to maybe do some more e-learning days, to stop spectators at sporting events and different things like that. So it's important for a lot of different aspects of our community to keep our positivity rate low. So what can we do as a community to facilitate that? We can wear masks. We can participate in the physical social distancing. If we're sick, we stay home and avoid large events. We know that this is spread at large events, especially large events and gatherings where masks are not being mandated by the facility organizers. So I know that there's a different fall events that are happening. But just because they're scheduled and they're allowed to go on because we're in phase 5 doesn't mean that it's the best thing for our community to gather, 500-600 people or 1,000 people together at a time, and only 30% of them having masks on. And of that 30%, we only have 12% of those wearing the mask correctly. So it's important that we wear our masks, we wear them correctly, and we wear them all the time when we're in public spaces.
Okay. Christine, I'm going to ask you, before we let you go one more time, I'm going to give you a chance to mention your flu clinic.
Flu clinic, this Saturday, from 10 to 2 at 601 East Main Street. That's the old Elder Bierman building. It will be inside. We will have enough separation for everyone to be separated apart from each other. And from 10 to 2, if that one doesn't work well for you, we will have plenty of other community events in the surrounding community and more here in Richmond. And if none of those work well with you, you can call the health department and schedule it, come in anytime. I will be soon having walk-in flu hours. So at any time, you'll be able to walk into the health department and get your flu shot without an appointment. I just have not been able to get that happening. But as soon as that does, Eric, I will let you know so you can get it out to the community.
Sounds good. Christine Stinson, Executive Director, Wayne County Health Department. Thanks again for the time. Appreciate it.
Thank you, guys. Thank you. Good to see everyone.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live. Our doctors, as they are every week, Dr. Thomas Huth from Reed Health, Dr. David Jetmore, Wayne County Health Department. Just look like you're ready to answer some questions now, right?
You bet.
You're ready to get to the good part. Okay, I think we can pull up the first one, and let's see what we got. Do you know why Wayne County schools haven't sent case information to the state COVID school dashboard? And would the Wayne County Health Department be assisting in that transfer of information? As we turn this way to Dr. Jetmore and go,
Well,
yo, what do you know?
Well, this is a great idea, the state COVID school dashboard, which is kind of a separate dashboard on the Indiana State Department of Health website to keep track of students that are being infected. I wasn't aware until this moment that our county was not sending in that information. I'm sure this is just newly started. If we haven't sent that information in, we certainly will. We want to participate in that.
Is that something you all do? Each individual school sends it? What is the mechanism
Well,
for that?
I don't know the mechanism for sure, but we get the information. We get the information from the local schools, so we would be the natural conduit to send that on to the state.
Okay. Next one up. Is the vaccine mandatory for everyone, or is it optional?
Well, I don't think that you can mandate somebody to get a vaccine. Maybe you can. I don't know that. You're talking about the vaccines that are being developed at the moment. I suppose that's what the questioner is asking, aren't you, Tom?
Yeah. So I suppose a little bit more context would be helpful, perhaps. If we're talking about the COVID vaccine or the flu vaccine, in either case, I'm not aware that we've ever been able to mandate anybody take those, at least from a public perspective. Now, it is true that some businesses can and do mandate their employees to take at least the flu vaccine. That is the case at Reed, has been for the last couple of years, and I think virtually every hospital in the entire state does mandate that now. There could be exceptions for particular reasons, but generally it's mandated. We haven't decided what to do yet about a COVID-19 vaccine. I'm not saying it won't be mandated, but we just haven't crossed that bridge
You're
yet.
talking about Reed Hospital.
Yeah, for Reed, as far as mandating the COVID-19 vaccine, if and when one becomes available. We're all assuming that's going to happen, and I take it that it will, but we don't know yet for sure. When one becomes available, I think what we're going to do is sit down and take a really close look at how it has come about, what's the data on risks and so forth, and then make a decision about mandating it. With the flu vaccine, it's a little bit easier because there's such a long track record, decades really of use of flu vaccines, and we know pretty much about how they work and what the potential risks are and the level of protection that they impart. We don't have much of that kind of information about the COVID-19 vaccine at the moment. When we have it, we just want to be deliberate about knowing all the information before we make final decisions on something like that. But having said that, I don't think that it's going to be possible. I just can't imagine that it would be even constitutionally possible for the state, as an example, or certainly the federal government, to mandate that every citizen have either vaccine.
I agree. I don't think it can or will be mandated, and this has been a dilemma for epidemiologists, because if you have a very effective vaccine and no one takes it,
right,
it won't be of any use. And that's why people have been concerned, and I think drug companies that are developing these vaccines have tried to be as transparent as they can to reassure patients that this is a safe vaccine, a safe thing for them to get. But if you think about the ordinary flu vaccine, I think the participation rate's only 40%.
Yeah.
And people worry that if we only have a small number of people taking the COVID vaccine, it's not going to be effective in getting us to the holy grail of herd immunity.
Right. The CDC actually has a long-term goal of trying to get 70% participation in the flu vaccine every year. And the closest we've come is about 50%. But sometimes, some years, it's much less. This year could be different. We're really making a strong push that everybody, if possible, should get the flu vaccine, because we have a fear about the combined effects of a uncontrolled flu season along with a potentially uncontrolled COVID-19 outbreak at the same time in the winter. And so it's clear the best thing to do is for as many people as possible get the flu vaccine. So I hope everybody will take advantage of the opportunity to get it at the health department vaccination clinic tomorrow and other times when those are held. But I have hopes that this year more people will be interested in the flu vaccine, especially those who are at higher risk of complications from both either flu or COVID-19. I think we've mentioned before, there was a patient locally who had both COVID-19 and influenza recently. Did okay, but was pretty sick. So, we don't like to see those together.
Our next question, I'm being told, is kind of a follow-up, or we'll continue this discussion a little bit. So let's bring that in and let's see. How will having the flu and COVID-19 affect a person? Is the healthcare system locally ready for that type of situation?
Yeah, so I guess I anticipated this question a little bit. We think that the potential to be extra sick is there. Are we ready to handle it? Yes. I mean, that we have plenty of capacity. We expect that capacity to be maintained, and things are a lot different now compared to the spring when there were ventilator shortages across the country, and that's almost not an issue anywhere now. I think the state website has pretty consistently shown that there are something like 40% of ICU beds still available in the state, about 80% of ventilators still available. And we provide reporting every day. It's mandated to the Department of Health and Human Services on our current volumes and capacities and such like. And so I think that data is pretty good. We have plenty of capacity, but we shouldn't take from that it's all okay. We'll just manage whatever sickness comes. We'd rather people not get sick. If you get sick enough to be in an ICU or on a ventilator, that's a real person suffering, and we don't want to have that. So we are much better off doing as much as we can to prevent that, and that's going to be the flu vaccine. It's going to be being really diligent about vigilance, safety, and being smart with personal protection this winter to prevent acquiring and passing on the disease. And, we'd rather not see those capacities be utilized at all if we can help it.
You're watching Ask the Doctors on WGTV Channel 11. Sometimes we move on from week to week. We throw topics out here and never come back. I want to see if I can maybe come back to one or two real quickly. One of the things that was talked about, and we're talking about the flu vaccine and maybe a COVID vaccine, we're talking about vaccine rates for kids and staying up with those. Have you, at the health department, seen an increase in the number of kids that are catching up on those vaccines? Have you all been able to kind of track how that was? At one point, there was a real concern because obviously people weren't going into doctors' offices, people weren't getting those checkups. Have you seen that getting better?
Yeah, I wish Christine was here to answer this because she could probably answer it more directly and with numbers. But I have the sense that people are catching up, but we're still behind from where our vaccinations could have been, should have been by the end of the summer. Typically, we want these children to be caught up in their vaccinations before school starts. But we're redoubling our efforts at the health department. We're just not dealing with COVID. We want to deal with all of the aspects of public health. And one of the most important ones are immunizations. To quote or paraphrase Will Rogers, I never met a vaccine I didn't like. Any vaccine you get, including the side effects, is better than the disease it's treating you for. So I'm kind of the opposite of an anti-vaxxer. I like not getting these diseases. So I'm a big proponent of vaccination. And especially with children. We have so many of these childhood diseases that we can prevent now. We should certainly do so.
And similarly, at Reed, our teams have been trying to find children that are due for their vaccines and reach out to their parents and get them in and try to catch those up. I think there's a feeling that we're not done with that yet, but we have made some headway. And I would tell you there are actually two reasons why we're really intent on doing that. One is because we want to get children vaccinated against the childhood diseases, as we've always done, because we don't want them to have the consequences of acquiring those diseases. But in addition to that, there is some evidence that getting vaccines, almost any vaccine, can elicit some general immune system activation that may be helpful in helping to reduce the odds of getting COVID-19 and maybe the flu as well. So, in fact, one of the vaccine candidates that's being studied, I was looking at the list this morning, is actually the Bcg vaccine, which is a vaccine against tuberculosis that's more commonly used outside the United States in areas where tuberculosis is more common. But it's being used because there is an association. It's being tested because there is an association between getting that particular vaccine and a couple of others have the same association. An association of that with reducing rates of COVID-19 in various parts of the world. So I think that's an interesting thing that's not commonly remarked on, but it's just further evidence that we really should all be paying attention and keeping up with the vaccines, and especially for children.
Are you finding adults, and I assume you keep up with some of what's happening in the hospital, are you finding adults that maybe had put off getting some of their checkups, getting back into that? I know I've been getting a call quite often from my eye doctor going, okay, you put off your last one, time to catch up on this one. Is that happening for adults with Breast Cancer Awareness Month being October? That's one of the things, obviously, you want to try to get people in, you want to have those checks because it is important. Are adults doing their part?
They're beginning to. A lot more people are getting engaged. And not only for mammograms and other screening testing, but also for things like colonoscopies and like that. There really had been kind of a dearth on those. People really didn't want to come in for those, completely understandably. And I think in the spring and early summer, a lot of people were reasoning, well, maybe this will be all over next month, and it can just go back to business as usual. But I think what we're all getting used to is the idea that this isn't going to be probably over at any really defined point in time. We're just going to do better with it. We're going to have options. We're going to mitigate, but it's not just going to be done and over with. And consequently, more people are saying, well, I guess it's time to kind of get this over with, because looking forward, we're talking about the winter months where there may be other issues on the table. We know that we've been in kind of a lull of COVID-19 locally recently, so people are trying to take advantage of that lull. And so we are seeing people, starting to pay more attention to those things now.
Before we go back to questions real quick, and I know we've got 3 or 4 lined up, I know you follow things that happen around the world and where COVID is. I've heard this week that maybe Europe is beginning to see a kind of a second wave.
This has actually been a trend that I've been seeing for really as much as a couple of months. Just slight upticks in a lot of Western European countries, Spain, Italy, England, Germany. They haven't had huge waves, but all of them are seeing significant upticks of what I would call at a moderate rate of increase. And many of them are beginning to re-implement lockdowns and shutdowns and things. They're doing that in a lot of areas in England. And of course, we don't want to see that here, because that has devastating economic effects that cause a lot of other suffering, not maybe physical suffering as much as mental suffering and job loss and life-altering changes in people's families' personal futures. So we don't want to see that here, and I think the key is to, in order to avoid that, we've got to stay very vigilant about our own personal protection habits.
Okay. Let's go back to some questions before we get to the weekly numbers that we get from Dr. Huth. What's the next question up? What are plans for actually controlling spread as we go to level 5?
Well, I think the plan is kind of the same blunt weapon we've used in the past, which is masking, social distancing, and hand hygiene. We're allowing more people to gather in restaurants and bars, and we can do this if we limit the time we spend there, wear masks. Obviously, you can't wear masks when you're eating. If you're going to go, it should be probably with your family or with people that you've kind of formed a bubble with, maybe your next door neighbor that you've spent time with. But the fear is in the past, whenever we've lowered this mitigation, people have not done that. They've said, well, it's over, it's level 5, the danger's over, and they lower their level of caution, and then we see the numbers grow up. It's amazing if you look in the United States and the different states how you have high mitigation, you have low positivity rates, then the mitigation gets lowered, the positivity goes up, and this goes back and forth. So that's the only plan we have for level 5, is to continue with the masking and social distancing.
I think it's important to recognize that level 5 is not completely back to normal. Really shouldn't think of it that way, because we are still being asked to do things. The face mask mandate's still there, and even though theoretically, bars and restaurants can seat at full capacity, can they really? Because they still have to maintain distancing and so forth. So I think there are still going to be natural limits to the number of people that can be fit into various spaces depending on what those spaces are. And so I think for some businesses, it's probably not really a lot different than it was at level 4.5 or 4. But you've referred to something, Dr. Jetmore, that is a concern of mine, that people will get the idea that it's okay to just kind of let loose and stop taking protective steps. And so what I fear we'll get into is kind of a seesaw whiplash effect, where we're doing great and people let off let things off and go back to quote-unquote normal, and then next thing you know, we've got problems and have to be more stringent. And what we need is a steady state, and that means people have to continue to do the right things all the time.
Would it be helpful if the governor said the mask mandate will last until January 31st or something like that? We've kind of got these 30-day increments where everybody figures when we get to October 17th, which I think is the next date, okay, it's going to come off.
Well, part of it may be if you put in that long deadline, you have this mental fatigue. People say, well, I don't know if I can do that for 4 months or 3 months. But if you say 30 days, you think, well, surely I can get through the next 30 days. And the other side of it, it gives, that 30-day period gives the public officials an opportunity to reevaluate the effect of what happened over that 30 days. So I kind of like it the way it is. I kind of like the 30-day periods. What about you, Tom?
Yeah, I guess I haven't really thought about that too much. I can kind of see it both ways. I suppose you could say, hey, just say it's till, pick some arbitrary date farther into the future, and if you can back off of it sooner, great. That would fall into the category of sort of under-promising and over-delivering, I guess. But I think to me, the sort of the cadence of steps right now, feels about right, and as long as people don't think that means things are going to end on October the 17th, because really all that is just a checkpoint. It's the next signpost.
There's nothing scientific about that date.
Right.
I mean, that date was plucked out of the air, and it could have been October the 18th at noon or any other date, but it's just a marking point.
Yeah.
Let's go with the next question. Do you think keeping a child out of the school system for an extended period of time will actually be a detriment to their natural immune system?
No. I felt like that needed needed an answer. When a child's kept out of school, he's kept out of school to I assume the reason in the context of this conversation that we're keeping a child out of school is because the child has COVID, or the child is a contact, that is, he or she has been within 6 feet for 15 minutes or longer with someone who had COVID. Now, the time that child is out of school, their immune system is not going to deteriorate, as the question suggests, in any manner. Your immune system will be as it was when they go back to school, with the exception is if they had one of the people that had COVID, they'll have antibodies and T and B cell memory of the infection when they return to school.
We've got about 9 minutes left to go. If we can pull up the weekly numbers, let's make sure we get those in, and then when we're done with the numbers, we'll see if we can wrap up the 2 or 3 questions that we have left. So, where do you want to start?
All right, well, we're looking at the read numbers here. I've shown different versions of this graph. This happens to be showing on the last 13 weeks, just to kind of zoom in a little bit on the right part of the graph. And these are the average numbers per week. And so far for the week that will end tomorrow, the week is largely complete, we're down on average in the all patients in isolation, which is the blue bar. The known laboratory positives have actually been down quite a bit on average, and the numbers on ventilator, it's showing 1 there as an average per day, but in actuality, as of this morning, we've had 2 days in a row where we've had no patients in ICU and none on ventilators with COVID-19. So that's very good news. Now,
you were hoping for that a couple of weeks ago.
What's that?
You said you were hoping for that a couple of weeks ago.
Yeah, and I wish the numbers would everything would go down to 0 and just go away. Unfortunately, the last 2 days, however, we have had an increase in the all patients in isolation. You can't see that here because I'm giving you an average for the week. And that makes me a little bit concerned because it kind of coincides with the county's numbers being up a little bit. But so far, so good with the read numbers, and we hope it stays this way.
Next slide, whatever that is.
Okay. I have brought this graph before, and it is updated with the numbers through last weekend. I did not include the now 2 days in October. It's not enough data for October to really be meaningful. And I bring it back. It doesn't really show much different than what it has before. I bring it back, though, because of something Dr. Box said in the governor's news conference on Wednesday. She pointed out that in the state statistics, they're seeing something very similar to what we have here, which is increases in the 10 to 19 and 20 to 29 age range. A lot of people attribute most of that effect to going back to school and people and kids being exposed to each other and passing the virus around. And then also an increase in the 40 to 49 year age range. This is very evident in the state statistics too. Dr. Box mentioned it. And in the contact tracing, they're seeing a lot of connections between the school-age kids and the middle-agers who've been increasing. So in other words, the home, the close family contacts of school-age kids who are getting COVID-19 are now also coming down with it, and that's driving those numbers up. We see that in these are statistics from Wayne County only, but it is reflected in the state statistics. She mentioned it on Wednesday, so I thought I'd bring this back today.
And last one.
These are the Wayne County numbers only through last weekend. I didn't include anything for this week because I only had the first couple of days, and it would be misleading because we know that the Wayne County numbers have been up the last 2 days. But through last weekend, we see a definite decrease down to, I think it was 29 last week to last Saturday. But we've far exceeded that already this week.
Yeah, the numbers, Sunday to Thursday numbers are 57.
Right. So if we were added another bar for this week so far, it would be 57. So that's definitely the wrong direction.
Yeah, that's almost at the level of the third bar from the right.
Right.
So that's not where we're wanting to go.
Okay. We'll keep an eye on that next week. We've got about 5 minutes left to go. Let's see if we can get at least one more question answered by these gentlemen while they're here. Is going to dentist for teeth cleaning safe?
I think so. I've been to the dentist, and I guess I haven't been to every dentist, so I don't know what they're all doing. I suspect they're doing many of the same things. My dentist does an awesome job with infection control in his office, really always has, and I feel very comfortable being there. So really it's they who should be more concerned about being exposed to me. You know, they have this parade of patients coming in for their dental work, but they are being very careful with asking screening questions before you come in, asking you not to come in if you have any symptoms, asking about your contacts with people, and they're asking you to wear face coverings, at least going in and coming out. Obviously, that doesn't work for the actual cleaning process, but they're doing a great job.
I think so too. I don't think people should avoid dental care because of fear of that. I had my teeth cleaned for the first time since the epidemic started. So I probably should have paid the dental hygienist twice, Eric, for removing twice as much tartar and plaque. But I had the same experience Tom did. I had a questionnaire. I wore a mask into the waiting room. There was no one else in the waiting room. Christy, my dental hygienist, wore a shield, which is not as good as a shield and a mask, but like Tom said, she's more likely to get infected from a patient than go on the other way. And I think the dental people are very cognizant of COVID and watch their behavior outside of the workplace. So I felt very safe. And for those of you looking in that have dirty teeth, get them cleaned like I did.
Thank you. Gentlemen, as always, it is great that you have continued to take time. We are at week 26 of this, I think. So literally almost half a year you all have been giving up part of your Friday afternoons to come in and do this, and we greatly appreciate the time. Seriously,
Very happy
every
to
week.
do it.
Dr. Thomas Huth, Wayne County Health Department. Reed Health. Dr. David Jetmore, Wayne County Health Department. I'm going in different directions here.
It's very confusing, Eric.
It is. Doctor.
We're easily confused.
Thank you both very much. Want to remind you that community testing is available a couple of different places in Wayne County, Monday through Friday from 8 to 6 at the old Elder Bierman site. 601 East Main Street. That site is open, and that site is being run by the Wayne County Health Department. There is also free COVID testing taking place in Cambridge City. That is the OptumServe site. Those were the folks who were running what was happening at Elder Bierman, but they have moved to 138 West Main Street in Cambridge City, and they are open Monday through Friday from 8 a.m. to 8 p.m. Richmond Farmers Market continues in Jack Elstro Plaza, 47 North 6th Street. That's every Saturday from 8 a.m. to 12 p.m. And if you're a little leery about going out, and we know that some people still are, you can do that online. I want to also mention that next week, with a number of things coming up for the holiday season, including some things for Halloween, we're going to have Denise Retz, Superintendent of the Richmond Parks and Recreation Department, will be our guest here on Ask the Doctor, so we can find out some of what their plans are and what they have gone through in order to prepare for a safe Halloween for the kids. What is an advanced practitioner? Interesting question. You can get the answer by checking out Read Beside You. That happens Thursday evenings at 8 p.m. on WETV Channel 20. That show is also available on YouTube. Some things taking place in the community this weekend. Downtown Chalk Fest from 9 to noon, right around the Farmers Market there in Elstro Plaza. Want to give a shout out once again to the flu clinic that is going to be taking place tomorrow at the Elder Bierman Building, 601 East Main Street. That's being put on by the Wayne County Health Department. And also something that will be interesting, a Fountain City drive-through fireworks display tomorrow at dusk. That ought to be really, really interesting. And last but not least, Hayes Arboretum Halloween Read and Roam tomorrow and the 10th. That's Tuesday through Saturday from 9 until 5. Check that out at Hayes Arboretum website. We'll be back again next Friday at 2 p.m. for another edition of Ask the Doctors. We appreciate them continuing to be here. Hopefully you get out and enjoy this fall weekend. As always, I wish you well. Stay safe.